There's people out there that are saying, go outside, get more sunlight, get more fresh air, put your feet in the dirt, and eat better, eat more clean food, grass-fed meats and clean vegetables without pesticides and, clean water. Don't even get me started on water. You were a nurse.
Spent 20 years as a nurse and absolutely loved nursing. It was one of the most rewarding jobs I've ever had. But medicine is, even back almost 15 years ago, when I left it, it was breaking down. And I saw the writing on the wall. And the average lifespan of a nursing career is about 10 years. And I was almost 20 when I walked through the doors of, I need to do something else. Much of that was so I could have a more, which is funny now because I travel so heavily, but more routine, what I thought was routine life for family. Decided I was going to coach diabetics because, again, diabetes, I've often said I'd rather have any condition rather than diabetes because diabetes is such a silent killer and people get it because they don't know what they're doing to themselves. And it's reversible. That was my goal. I was going to teach people how to take back control of their lives nutritionally and have better quality of life at the end. So make a plan, make God laugh. So I flew down to Florida to do some continuing education that was legitimately CE certified, et cetera. Had a wonderful weekend, was flying back home. It was February in South Dakota, and I'm flying through Denver because you don't ever fly direct, and ended up in a situation where the planes were grounded for 3 days. And I thought, I'm not sitting in Denver's airport for 3 days or even in the city. So I jumped downstairs to the car rental line, and there's like 9 people in the line, and 6 of them were going to Rapid City, which is where I lived. So we ended up carpooling. The gentleman that was driving was a retired dentist who had developed a laser, and he told me it was going to cure diabetes, it was going to cure cancer, it was going to cure every disease we know of. And I just looked at him and I said, tell me how it works. And he couldn't tell me how it worked. And I said, so you don't know how it works? I've never heard of been a nurse for 20 years. I said, I have to say I'm sorry, but I'm not in. So I was a little rude, forgive me for that, but I went and climbed in the back seat and went to sleep. And then about fast forward 8 months, I drove across the state to see my mom. It's about a 400-mile drive, and I was late in the day. I was kind of tired, so I pulled off at a rest stop and just put my head against the window to take a quick nap. 20 years prior to that, I had had 2 significant car accidents. And so I have a reverse curve, I have a compression in several areas, and bone spurs, and I still have a fracture line. It's a mess. Wow. But you add 20 years of time to that, and it starts to become degenerative, and every once in a while it would flare up on me, and I'd have a lot of neck pain. Well, this time it flared up, and I couldn't get it under control. About 3 days in, I couldn't move my right arm voluntarily. I started carrying it around with my left arm. I was in the worst pain of my adult life, and my first son was over almost 9 pounds. So there was no comparison. It was the worst pain I'd ever been in, and I was literally pretty much on my back if I wasn't at a doctor's office trying to figure out how to get better. And everybody that I talked to said, you need surgery. And I said, I'm uninsured. I'm for the first time in my career, I didn't have insurance because they always gave it to me. And I thought, I'm just going to do some quick CE stuff, get myself up and running, and I'll be fine.
I won't need it.
I won't need it. Again, that's putting me on a path that I had no choice but to try things that I would have otherwise not tried because I had no belief in this red light therapy stuff. But I tried everything else first, and I was losing. 5 weeks later, I still couldn't move my arm, and I was starting to get atrophy, wasting muscles. And of course, you got to live. You got to go to work, and I couldn't do that. So I finally called this gentleman up that I had been rude to in the car and dismissed.
This is the same guy that told you about the lasers.
And I said, all right, I'm desperate. Send me to a practitioner. And I went to a local chiropractor that had the equipment, and I said to him, I'm a clinician. I've already done the chiropractor. He fired me because I was not getting better, and I was doing some damage. And I said, I just want to try this as a standalone therapy. So he did just the laser therapy, and in the first session, I thought, well, I've wasted another $500. And he said, just trust the process. I need to come back in 2 days. We'll do it again. And by the end of the week, you should start to see some improvement. On the second session, I actually felt visible pain relief in that 15-minute therapy where he was treating my neck. And I didn't know if it was placebo because I wanted it that badly or if it was actually real until the next morning I woke up and I had full range of motion in my arm. For the first time in 5 weeks, I could do whatever I wanted to do with my arm. It was tight, it was sore, and it was weaker, but it was back. And I was blown away and thought, oh my gosh, this is actually real. And so I called him and said, can I come back in today? He said, no, this is a process. There's a reason we do what we do. Come back again the next day, which would have been Friday. He did the initial work and then he switched to a stronger device and did a whole series of trigger points that was where the tenderness came from. Now it's 15 years later. I still have never had any flare-up again. I've never had significant issues with my neck. I used light therapy consistently because I actually went immediately to that guy's office and said, how do I get involved in this industry? It's brilliant. It's what I want to do. I've never flared up that bad again because I've always had access to a laser. And if I felt any, because you can tell when it's going to happen, I call them zingers. I just treat it and it would take care of it. So it's been the most profound aha moment I think I've had in my life. And the irony is I couldn't figure out how it worked. I couldn't find anybody that could legitimately tell me how it worked. Until about 4 years later, I found myself in a training course for a guy by the name of James Carroll. He's absolutely brilliant. He's from London, or north of London, but he's from England, and he has done more for this industry than any single individual, in my opinion, because he is an engineer and he asked questions outside the box all the time as a manufacturer of equipment to try to help people understand so we could educate, because he knew education was going to make a esoteric therapy mainstream. And so I had the pleasure of working for him for about 5 years. We ended up going different ways because my experience clinically was very different than what he was teaching on the science, because rats and humans are very different sizes.
Sure.
And so clinically we saw okay results. But when I found the class 4 devices, which put out volumes more light. So light is a very physics-based technology. And if you change the way light is delivered, the tissue responds very differently. So focus of the beam, intensity of the beam, how much you deliver, what colors you use. So if those parameters are tweaked, you're going to get a different outcome. And there are so many ways to tweak it. So and this was the nurse in me. We saw things clinically for years, long before they would research and say, hey, we should use this drug for this. We'd use them off-label. We called it off-label. And the doctor could do that because we'd see it long before the science says we should.
We're still doing that now from our clinic side on the hormones and everything like that. We have to prescribe so many things off-label because just mainstream medicine doesn't recognize it.
And the interesting thing about light is back then I couldn't find any research. Now they're publishing over 40 papers a month, but they're small bodies of evidence because there are so many things you can study, because the way light works, I'll pour it in. From the top of your head to the bottom of your feet, if I think I can reach it, I can affect it in a positive way or inappropriately dosed in a negative way. Or I should say inhibitory. It's really not a negative as an option. It's just an amazing technology that if you understand the math, you can point it anywhere.
Now, for people that don't understand what light therapy even really does in the body, can you give a quick explanation?
Yeah, application of light of very specific parameters. So primarily red and near infrared wavelengths. Those are called non-ionizing wavelengths. So ionizing wavelengths, people have heard of the electromagnetic spectrum and radiation. The word radiation scares people. All light is radiation. Where it lands in that spectrum determines how the cells put it to work. And so it's either ionizing, which is causing free radical damage and potentially causing harm, depending on the amount being exposed to and how often, to non-ionizing wavelengths, which are just the opposite. They actually absorbed and put to work in a positive way. So the application of very specific colors, very specific intensities, because strong intensity is inhibitory and downregulates cells. Low intensity actually is stimulatory, and it does one thing exceptionally well. It displaces a little free radical. It's a molecule called mitochondrial nitric oxide. That blocks up the oxygen receptor site in the cell's energy production cycle. So this terminal enzyme in this cycle is called cytochrome C oxidase, and it's where oxygen belongs. But when a cell is under stress, whether that's a slow and insidious stress like bad food creating diabetes, or a injury, a car accident, this molecule gets produced in excess quantities and it has a higher affinity for this oxygen receptor site than oxygen itself does. So it blocks it, which means your cells aren't breathing like they are supposed to. I tell people, think about when you walk up a set of stairs fast and you're not in very good shape, you're short of breath. You can still do what you need to do, but you're still not working at optimal function. That's what your cells are doing.
That's the oxidative stress.
Actually, it's not yet. It is the trigger for oxidative stress. So when that The body's always checks and balances, so it's always trying to neutralize and balance things out. So we neutralize free radicals with rest and antioxidants. Well, most people don't do either one of those well in the world that we live in. So if the injury is significant enough, like a chemical exposure would be a really good, or a viral exposure. Think of COVID over the last couple of years. So if the exposure is significant enough, it triggers a production of a very volatile free radical called reactive oxygen species. And it's, again, a molecule that in very tiny amounts is really good for us because it triggers natural healing processes. But in excess amounts, it creates oxidative stress. And oxidative stress, I tell people, if you've seen an apple turn brown, you've seen oxidative stress or a pipe rust. It's oxidation of our cells, which triggers damage and if the teeter-totter balances in a way that we produce more than we can neutralize, it starts to do damage to the cell itself, and it's actually the cause of every disease we know of. So it's a very negative cascade in the wrong direction. So why light can be so profound and why I can point it from anywhere from my head to my toes is because light works at that very first step in the process, which is where the oxygen can't attach because that molecule is in the wrong spot. It does one thing really well and it bounces that molecule out. And what it does is then the local blood vessels will absorb that molecule and it creates a vasodilation effect just like Cialis and Viagra does. So it opens the blood vessels, more blood comes to the area, more oxygen comes to the area, more nutrients come to the area, and now this oxygen can attach like it's supposed to. The cell starts to breathe again, starts to make energy, so it has enough gas in the gas tank to do the job it's supposed to do on a daily basis, and everything starts to normalize. So the miraculous healing that occurs from light therapy, people make claims to light doing this, that, and the other thing. It's not doing those things. It's removing the roadblocks so the cells can do what they're simply programmed to do.
So what you're supposed to do. So your body's going to react how it's actually supposed to react.
It's programmed.
Without that inhibitor.
It removes the roadblocks. You add good building blocks, which is nutrition. That's why I love IV therapy, because we can put those very quickly back into the body because we're so bad at how we eat in this country.
Yeah.
And so you remove the roadblocks, add the building blocks, and healing can be extremely profound. I have seen true miracles in the last 15 years.
Now, there's a lot of people now that are probably more on the naturopathic side. They're getting away from mainstream medicine.
Especially since COVID. Yeah, people are afraid.
Well, I mean, for justifiable reasons.
Absolutely.
You know, the mainstream medical community, they've gotten a bad reputation lately.
They're overwhelmed. It's not the professionals. They're amazing individuals. They're overwhelmed, and the system is very broken.
There's people out there that are saying, go outside, get more sunlight, get more fresh air.
Put your feet in the dirt.
Put your feet in the dirt. And eat better, eat more clean food, you know, grass-fed meats and clean vegetables without pesticides and, you know, clean water. Don't even get me started on water. I just installed a reverse osmosis system in my house, and I'm installing another one for everybody at the office. And I have been huge. I literally have spread this to 3-4 friends already that have already put the same systems in their house.
Great.
And when I started drinking this water, I can taste the fluoride, the chlorine, and all the chemicals in every other water I've ever drank.
Absolutely.
I can taste it in this right now.
They call them volatile organic chemicals for a reason.
It's crazy.
Well, think about our grandparents. There was none of the conveniences of the world that we live in today. So they were organic before it became a buzzword. They grew everything that they ate on the farm. There wasn't the fertilizers that we use today, which, by the way, fertilizers put in 4 elements back into the soil, and we have 67 essential nutrients, which essential means we have to take them in because our body doesn't make them, that are required for natural or cellular health. We get 4 from the fertilizers that go back into the soils, which is why our soils are so overworked and our food is so it's just not nutritious anymore. It hasn't been since the 50s. So we can't even eat well and eat well. You have to supplement. You have to bring nutrition back in a different way.
It's very hard in this country.
This world we live in is so convenience-based. Think about, you just get up in the morning and you take a shower. We're vaporizing and breathing into our lungs a known carcinogen for probably 10 or 15 minutes. Chlorine is there on purpose, but it's a carcinogen. So we start a day creating quadrillions of free radicals, and then our body goes, okay, now what do I do with this? It's no wonder, we're genetically programmed to live 120 years. We average as a country 75 years of age, and women have caught up with men in diseases now. So we average 75 to 80 years of age. We've lost a third of our life to free radical damage.
My new favorite term, lifespan, and the one that I really love, health span. How long you are healthy while you are alive. That's my new thing to say. And I tell that to everybody that I'm talking to from a, clinic standpoint. I'm like, I want to increase your health span. I want to increase the time you're alive.
And you can. That's the beautiful thing. Our bodies are so amazing. You're on this paradigm from sickness to wellness, and you're somewhere in between. And if you change your life, you can affect it in a monstrous way and now you still have a genetic code that you can't, but I've seen people with horrible genetics live better quality of life by living extremely clean and adding these alternative, or what I like to say is immune supportive and health supportive technologies into their life versus people that are born with, great genetics and abuse themselves for years and years. Eventually, you're done. I mean, your body can only withstand. As a nurse, one of my favorite phrases as I teach people, because I think if you understand, you can't unlearn what you've learned. So you have to think about it every time you make that bad choice from now on. I ruin more people's Diet Coke habits on an airplane than I can count, because I tell them that it converts to wood alcohol and formaldehyde at 86 degrees. Your body's over 86 degrees. You're creating two known carcinogens that cross the blood-brain barrier and go up into your brain every time you sip on a Diet Coke.
Literally causing yourself brain damage.
What are you doing?
Yeah.
Yeah.
I go back to, I felt amazing when I was in Europe for 2 weeks. Probably because of the food, the water, the air, being in nature, being in sunlight, everything like that, less stress. But that environment made me less stressed because I was still looking at work. I was still looking at, what was going on in the office sometimes. Yes, I was on vacation, but I was there visiting family. But the way that everything operated there, my body just felt better. So in America, we have all of these problems, the way that we live, the way that we function here, all of the things that are causing oxidative stress, inflammation, from our food to our water. So how do we correct these things? One of the things that I see that is becoming a huge problem, which is what my clinic focuses on, is the hormone side. Everybody is having severe hormone problems. They're saying that, I think wasn't an FDA study, said that men by 2032 at this rate will basically all be infertile. The sperm count will be zero if it progresses to this point.
There's so much in our food sources that change our natural hormonal responses. Men have higher estrogen levels than some women do. I mean, look at the physical bodies, which reflects that on the outside, what they call dad bods or the man boobs, for lack, forgive me for the phrasing, but it's not normal and natural. It's an imbalance in hormones, and you cannot feel well if you're that out of sync. I mean, so to your question of how do we get back to what we're genetically predisposed, lifestyle choices, 99%. I mean, you can't argue with your genetics, but you can create lifestyle choices. And again, education, because people they say, okay, great, what do I do? And there's some wonderful organizations out there like your own that can take you through that process and say, if you'll trust me, I'll get you back on track and I'll teach you on the way. And it's a process, not an event, because I tell people all the time, when they come into the clinic and they'd say, I was healthy as a horse until, and they'd start, and they usually say I was 45 or 50. I'd say, no, you weren't. Your lifestyle kept beating you up, and at that line in the sand, your body says, I can't do this anymore, and you start breaking down. So now you're just seeing the physical manifestation of the choices you made. But it doesn't mean that that's over. It means that you can start making better choices because your body is incredibly, even 20-year smokers, they've taken pictures of before and after, the lungs. That lung tissue can clean up pretty darn good. And again, I've seen miracles, and I've seen all the big diseases go different directions. I even had a gentleman with congestive heart failure recently. We're not technically supposed to be able to reach the heart with light. So there's a systemic benefit that happens with the bed. When you're in a full body light bed, every outside cell and up to about 3 centimeters in the body is being saturated by quality light and reducing inflammation and oxidative stress. And then again, they can go on and start healing things. So it's systemic. And they've proven that if they put diodes on the head, and they've proven, or even a pulse oximeter on the finger, your oxygen levels go up dramatically to 100% within 30 seconds of being in the bed, even if you're breathing room air, because of the way light works. And then they've actually shown what's called an increase in oxyhemoglobin and deoxyhemoglobin, which shows that the brain has better respiration and better cellular metabolism within 30 seconds of turning on these light beds. And that was the first bed that was put out, and it's not near the parameters of the newer beds. And our bed is the rock star, to be honest with you. You have two delivery systems. One is a systemic or full body system, which is your health. This is where your health comes from. Combating inflammation is the primary mechanism. And how do you do that if you've gotten 30 years of bad choices? You've got a lot of breakdown. So again, cells can repair, and you just give them the environment they need. And again, the building blocks. So take the roadblocks away. So it's about consistency. You're not going to exercise once and have the body you want.
Exactly.
Or even once a week for 6 months. No, unless you have an incredible rest of your life, diet and all that, and rest and all that. But you have to be consistent with your choices. So light can be an amazing intervention for that.
Is the mainstream medical community looking at this and saying, like, holy shit, what is going on here?
Depending on the doctors, which is really neat, because more and more doctors are outside the box thinkers now. They're not, we all know that big pharma is a big piece of education for our health professionals. And if it's keeping people healthy, they're not terribly interested. So, did
you say that out loud?
Yes, I did. But health professionals get it, and they know it, and they're locked into what what they do by what's called gold standard medicine. If you don't practice gold standard medicine, you can lose your license. So they have we have to offer you this, but if you do this too, is what they're saying now. If you do these health interventions, you can help accentuate your benefits. So more and more health professionals are on that. And if it can do no harm, and it has all these studies that prove benefit, I've literally listened to doctors dialogue back and forth, and I'm so excited, because 15 years ago I thought this would be everywhere in 5 years. And now I'm thinking maybe now in 5 years we're actually going to be everywhere, because the more and more exposure we're starting to move mainstream. And this spinal surgeon is a great example. He's looking at putting 20 locations in Minnesota to start with, and then going nationally with it. And it's going to be light therapy, PEMF, these cocoons, as I mentioned, to get oxygen therapy. And there's one other, it's actually a camera that you put under the tongue to measure your cardiovascular health. It's phenomenal. It's a great measurement tool of the progress you're making. So validation for people. Other than they feel amazing,
Sure.
Here's your clinical on your blood work, and here's your clinical on your that test.
And that's what's amazing, is that all these things can actually be tracked.
Absolutely.
Now, on the oxidative stress side, is that able to be tracked from a clinical perspective, or is it kind of more...
That's the inflammatory markers. So you have to measure like homocysteine levels and sed rates and things like that.
So we can do that on the lab side.
Pretty much.
Since we just kind of started doing this earth oxygen light therapy at my clinic at Aspire Rejuvenation, we just launched it on the website. We kind of did a soft launch. Everybody at the office uses it. So every single one of my staff.
So now they can't help but rave about it.
Oh, because it works.
It works.
I mean, when I started doing, I did all of them. I did the whole Superhuman protocol, Da Vinci Medicine's Superhuman protocol, which is how I get introduced to you, and TeraLight. So thank you to them. But when I started doing the therapy, and then I started really doing the red light therapy, I'm big on the PEMF and the red light therapy. The oxygen, I need to get used to. I don't like wearing the mask. But I know how beneficial oxygen is.
You're young
especially
and healthy, so your lungs work great already, but
One of the main things that I have problems with personally is a hip problem. So I have a left hip issue that's kind of like an IT band issue. It's probably due from when I was in law enforcement for a decade plus, wearing a 30-pound belt. You know what I mean? Sitting in a tiny Crown Vic, because that's what we drove back then. For all you cops that are driving nice cars now.
Right, Chargers.
Chargers and Ford Explorers. Yeah, I was driving a Crown Vic for most of my career. When we were in those, you had a lot of pressure on those hips and everything like that. So it messed it up a little bit. Within 3 sessions of red light therapy, I woke up one day and I'm like moving around, and I look over at my wife. I'm like, my hip doesn't hurt. And she's looking at me. She's like, I didn't know that your hip hurt that bad. I'm like, oh, it's like debilitating every morning when I get up.
You're like an old man getting out of bed.
Yeah, old man getting up, and I have to stretch it out, and I have to massage it a little bit. I don't have it anymore, and it would cause me problems. Not really walking and things like that, or sitting down, but when I was exercising, I love to lift weights. When I was squatting, I would always notice that I would favor one side and I would sway because I had that hip problem. Now I don't have the issue. It's anecdotal. But
real.
It's real for me. Real. What else did it? Nothing else did it.
Light is extremely well at managing soft tissue. Inflammation causes pain. So we hear the pain reduction all the time. I tell people, if you push on yourself, it's not supposed to be painful. There's a mechanical dysfunction that's causing soft tissue pain, which is why when in the pharmaceutical world we're using the drugs, it just simply covers up the symptoms. There's really no solution. By driving down inflammation or breaking that cascade, you get more in circulation, more mobility when the discomfort and the inflammation is gone, and you're back on track. We are brilliant at soft tissue recovery, from wounds to aches and pains and creaky joints. You can still have a horrible mechanical dysfunction and have almost no pain because the symptoms reside in the soft tissue. That's why our spot therapy device, you can point to where it hurts and I can take pain away in 10 minutes less, and 80 to 90 to 100% in 95% of the cases. If I can't make it feel better, there's a mechanical dysfunction that needs surgery, in my opinion.
Okay, so you have a ligament tear or something.
Or I'm pointing it at the wrong spot, or a bone spur that's hooking on a nerve or something along those lines, yeah.
When you're healing the pain, is that something that's temporary? Do you still then, so you're getting that temporary relief, then you have to work on fixing the mechanical issue?
You use the phrase healing the pain. The first time it's literally just downregulating the nociceptors, which is the Band-Aid, and dropping out inflammation dramatically, which allows for pain to go away through the healing process. So it's a process, not an event. So the first time you feel amazing. I don't care if it lasts 2 hours. Sometimes I've seen it last 2 weeks from a single session. But if you do it consistently over the course of 2 to 3 weeks, it becomes sustaining and significant. You may have to go into a maintenance process because you still have a mechanical problem that's going to drive that to recur. My neck is a perfect example. I treat it about once every 2 or 3 weeks and I'm back in under control again. But if I stop treating, probably in 3-4 months, I would be going, gosh, I'm hurting pretty bad again. And I'd have to start over with a couple weeks of therapy.
Well, that's a mechanical issue that can't be solved
unless
unless you have surgery.
And I have better range of motion than most kids. And if you saw my neck, every time I show my x-ray to a chiropractor, they go, oh. So it's pretty good.
Yeah.
Pretty significant. So
the soft tissue one is the one that I use mainly. And I know because I have them marked down on which ones I'm supposed to use. Because for me, I don't really have any health issues, any issues whatsoever, except for soft tissue, and it's all self-induced.
Sure.
It's all from
that's what you want to
25 years of bodybuilding. You know what I mean?
Yeah.
So I'm not going to stop working out. I'm not going to stop exercising. But you're right. When I touch on things, they shouldn't hurt. When I would touch on my IT band on my left leg, or in my hip area, or on my upper glute, there'd be problems. So and then ever since I started the red light therapy, there's no issues.
If you stop doing it, which you probably won't do, it's not, unless there's a mechanical problem, it's not probably going to come back.
I'm going to basically summarize this as this light, the way this light works, is pretty much able to tell your body to do its normal thing, to do its normal processes.
Removes the roadblocks so it can do what it's supposed to do.
So your body being a miraculous healing machine, it can constantly be healing any issues that you have, mostly. All those roadblocks that our environment, that our lifestyle is putting in there, this is basically removing those roadblocks, allowing the body to heal those problems.
You're healthier when you got out than when you got in every single time. Consistency is the key because the world we live in is convenience-based and drives free radical damage, so we have to manage it. Aging is a normal process, but our cells accelerate through that process dramatically, which is why we die at 75. So I'm not telling you you're going to live to be 120, but I'm going to tell you you're going to have a much more quality life and burn out like a light bulb. That's my goal, instead of die for 10 years. So, and you can't hurt yourself with it when it's properly dosed, legitimately. The top researcher in the world in this industry is a gentleman by the name of Michael Hamblin. He's out of the Wellman Institute of Photomedicine, Harvard. So yes, light has been studied for lots of years in very credible organizations. He focuses on brain health. The majority of his work is on brain health. He also does things around what's called photodynamic therapy, which is cancer treatment, which is pretty exciting stuff, different conversation around light because it's dosed differently. But the point I'm making is, he said in these light beds, you'd have to be in it for 8 hours to over-treat or overdo. And no one's
going to do that.
Nobody's going to do that. The inconvenience factor. But it doesn't mean that you can't eventually overdo, because light is cumulative.
Sure.
So it takes less light to keep you healthy than to help you get healthy. So if you keep treating with the same quantity and intensity that you did in the beginning, you'll likely start to see less benefits. So what do? Stop going for a little while.
Yeah, so there's a loading phase and there's more of a maintenance phase.
Your maintenance phase. I think the world we live in, maintenance phase is twice a week. Just because we live in such a toxic world.
Which I'm doing 2-3 times a week right now.
Yep.
But I'm probably putting myself under...
But you're training too.
Yeah.
So those that are... there's 3 primary categories. You got your athletes, because light is actually cell protective as well as cell regenerative. And so when you're using it consistently. So exercise damages cells by design. We get stronger as a result. But they've shown that with light therapy, the cells can actually recover in less than 12 hours. Fully recover. You can take a muscle to failure. It typically takes 72 plus hours. But you can fully recover in less than 12 hours with properly dosed light.
Which means bodybuilder fans that are watching, you'll be able to train more often.
Yes.
And you'll be able to gain more muscle. Where can they find more information about TeraLight, about Aspen, about you? Where can everybody watching find more information about this?
So the best places to go are TeraLight.com or AspenLasers.com. We have YouTube sites, Instagram, those types of things. Those are relative. The YouTube is the best probably for the videos.
Okay.
I actually have a training video on Aspen Lasers YouTube. It's a 3-hour how light works from a molecular or cellular function. If you're the nerd of the room and wants to understand why, it'll take you all the way up to equipment. And then we break away and train how to, because it's a training course for anybody that wants to know. I don't care what equipment you use, and then we teach you how to use ours because I know the math around ours.
I very much appreciate you coming here.
My pleasure.
Meeting with me. Thank you for everything you did from our clinic side, because that TeraLight training that you did with us, everything we learned from you, all these stories. And again, I have no doubt that this episode is going to stir up a lot of conversation.
Which, by the way, feel free to share my phone number and email too. I'm constantly helping people tweak what they're doing. So it's what I do. It's what I love.
Thank you for everything that you're doing with this light therapy. I think it's going to be a lot of what New Age medicine is going to be. It's going to be a staple at the Aspire Rejuvenation clinics that we're going to expand to. I want to put these therapies in every one of the clinics.
That's wonderful.
That's what I want to do, because that's what we're about. We're about increasing that health span. We're about increasing wellness. We're about making people realize that they can live a much healthier life and not just provide Band-Aid after Band-Aid after Band-Aid that the health industry is unfortunately doing. Thank you so much for sharing this information with us.
It's been a pleasure. Thank you for having me.